Hi, I'm Dr. Elizabeth Coyne, and I'm just going to do a quick overview of how to prepare your work and the steps needed for 7103. So I think the first thing to think about is look at the options, work out what's best for you, discuss this with your supervisor, identify what might be useful for your clinical practice, what might be useful for your progression as a registered nurse, maybe into a research area or into an academic area. Remember, you need to follow the guidelines. You need to sort of look at the published work and follow how that's presented. So we're not wanting you to make your own style of literature review. It does need to follow publications. It needs to follow frameworks, which are integrated review, systematic review. There's a whole range of different types of reviews, but you need to follow whatever format you have chosen, and that needs to be clear in your method section. When you're getting started, being aware of sort of where to start. So looking at the databases, this is all actually on the module that we've developed. But just to remind yourself about the fact that you need to look at the different websites for databases, choose from the database, have keywords, and look at how many articles you're getting and how you actually are keeping them. Remember, the whole process is systematic. Even if you're doing an integrated review, you need to be systematic with this. So remember to keep your search terms and your numbers. I find using an Excel sheet is a great way to make sure that you can expand it as needed, have different tabs as you're moving through the different stages. So thinking search terms, databases, numbers. Data appraisal. Now, this is where you've got to remember back to that early research that you might have done in second year, which could be a long time ago or just a short time ago. But you need to think about this article, where it's published, who is the authors, is it trustworthy, relevance, how many, what was their method, what was their sample size. These are all aspects of critique. So use a tool. So we've got some different tools there. We've got some articles in the readings about how to critique research. And then think about, it's got to be a stepped process. Is it valid? What are the results? Are the results useful? And this is that whole aspect of data appraisal. So once you've included this article, then you've actually got to look at, well, why did I include it? What is it saying? And what does this mean? Again, the sort of thinking about the marking criteria, remembering anything you're handing in will eventually get marked. So this is the knowledge of the topic area and use of literature. So this is your search terms, your strategies, your sort of analysis. 40 marks. So making sure that you really present that well in your end product. Which appraisal tool to use, and you will need to use one. So you need to decide what appraisal tool meets what type of manuscripts and literature you're having, talk to your supervisor, and then work through and choose that and use that tool, identify that in your method as you're presenting your final product. The data extraction. Again, I love the use of an Excel sheet because you can add columns, but literally what you're doing is summarizing each paper you've included that met your inclusion criteria, and working through that, identifying what is important for you then to present in your results. So it doesn't need to have every aspect of this paper, but you're extracting the data, summarizing it in your own words to present and then critique and sort of bring it together. So if you were presenting something about sort of health literacy tools that RNs use, you might list the tools and have that as part of your data extraction, which then you have as a paragraph in your results, and then a paragraph in your discussion, and then in your teaching, if you're doing a teaching tool or something else, then that would be what you'd include. So it's got to have that flow. So think about, what is your research question, inclusion criteria, manuscripts included, what data needs to be extracted and why, and then summarize and bring that together through to the last sections, your discussion, and your final part of your paper. So again, look at the marks that are related to this. So analysis and arguments, 20 marks. So arguments are logical, well organized, they're fully aligned with what you identified at the beginning as your research question, and there's this transition between the information and a high level of critical thinking skills. So it's not just a descriptive aspect. This article presented this, this, and this, but this article presented this, which was linked to that, which meant this. That's critical analysis. So make sure you're going beyond just description to actually critical analysis. Recommendations, again, these are what you developed. So these aren't the recommendations from each different article, but from all articles put together. So again, that critical thinking. So recommendations, impressions, you have sort of a column for that. Dot point, sort of that you might have in your table, and then bring that together into your article as a nice flowing recommendations. Remembering that sort of identify the strengths and weaknesses. So maybe, this study, the sample number wasn't actually big enough to provide information, but you may then have a recommendation that future studies may have larger numbers to identify whether this intervention was actually a useful intervention and worked well. Do the authors describe their design and methods? Have they analysed their data well, and was it described well? Do the results ring true, and are they based on what sort of sample size? So again, this all links in with your recommendations. From these articles that I included, what do I recommend? What might be in relation to clinical further research? Again, worth 20 marks, and this is recommendations and conclusions. So targeted recommendations made for practice, education, and future research. So don't just have it all based on clinical. It needs to have that sort of look so you're understanding further research might be needed. There might be a need for education that links specifically to these recommendations. Or are they just clinical practice where it's not so much about educating the RNs, but just an actual practice change? So thinking about what your recommendations are and how they're worth 20 marks. Presentation, again, smooth, coherent. Look at the flow. Your background needs to present. What is this topic? What is my research question? What is the significance of looking at the topic? How am I going to look at it in method? What sort of tools I'm using for data extraction, appraisal, analysis. Results are presented, they link nicely and flow from that background research question through to then the discussion, which is, so what does this all mean? And then your recommendations, which says, from looking at these articles, I've made this analysis, presented these points in discussion, linking it to other research, and I've come up with these recommendations. Make sure you really do work with your supervisor. This is one of the few courses where you actually get a great supervisor who is a clinician and researcher in the area of your practice. So you can send them emails, meet with them on a sort of decided basis, and then they can look at sort of maybe 1 or 2 drafts over the trimester. Thank you, and enjoy this unit.